Good afternoon, and welcome to Well Aware with Michigan Medicine, a series of community discussions to keep you informed. My name is Dr. Gregory Dalack, and I have the privilege of being the chair of the Department of Psychiatry at U of M. Thank you all for joining us today. We sincerely want to thank all of you for the many ways you provide support to Michigan Medicine. Let me also say thanks to those who submitted questions on the RSVP form. We will be working to answer many of those questions later. Unfortunately, we will not be able to collect questions live during today's webinar. We received a very large response to the webinar invitation today, and we are thrilled and gratified, but not shocked. 10 or 20 years ago, I might have been surprised by such a large turnout for an event focused on mental health. But we've witnessed significant shifts in attitude in recent years. It's not that psychiatric disorders haven't been present all along in our communities and often having a disruptive impact on our own lives and those of our families and friends. Rather, our society is finally ready to acknowledge that it's time to do away with stigma and actually talk about mental health and to focus on finding better treatments and cures. These illnesses impact all of us, but they are illnesses that are treatable, and there are many reasons to be hopeful. Today is World Suicide Prevention Day. September is Recovery Month. Prevention, early intervention, self-care, maintenance of wellness, and enduring recovery are themes we've chosen to focus on in today's webinar. During this unprecedented time in our country, individuals and families are struggling with high levels of uncertainty and fear, anxiety, isolation, and depression. We have assembled a panel of faculty experts who can shed light on the impact of the pandemic on mental health and share strategies for mental and emotional wellness and resilience. I'm pleased to introduce the panel to you now, and thank you again very sincerely for participating. Dr. Jill Schneiderhan is Assistant Professor in the Department of Family Medicine and Co-Director of Integrative Family Medicine of the Integrative Family Medicine Program, and she will talk today about the importance of addressing mental health concerns early through primary care, and will cover self-care strategies anyone can use to manage their own wellness. Dr. Polly Gipson is Associate Professor of Psychiatry and is the Director of our Trauma and Grief Clinic. Dr. Gipson is an expert in suicide risk in adolescents and young adults, and will discuss specific struggles and wellness strategies for this population during COVID. Dr. Mark Ilgen, Professor of Psychiatry, is an addiction researcher and is the Director of the University of Michigan Addiction Treatment Services, otherwise known as UMATS. Dr. Ilgen will cover topics around substance use and misuse during the pandemic, as well as managing recovery and preventing relapse. And finally, Dr. Elizabeth Duval, Assistant Professor of Psychiatry, will share her expertise as a researcher and as a clinician who treats patients struggling with high levels of anxiety and PTSD, both of which are exacerbated during the pandemic. And now I'd like to invite Dr. Jill Schneiderhan to join us for her presentation.
Hello, thank you. It's a pleasure to be here today. I'm super grateful for being invited to join my colleagues from the Psychiatry Department to talk about supporting mental health through wellness. You can advance my first slide. So I realize this slide is a little bit busy, but what I really wanted to highlight is just access to mental health treatment. These numbers here on this slide are really from prior to our current COVID pandemic. And just to note that we already were seeing worsening youth mental health, increases in adult suicidal ideation. Although we were improving the number of Americans that we were insuring, we were still lacking mental health coverage for a lot of Americans. And so there's still a pretty big unmet need even prior to what we're dealing with now. Next slide. Here in Michigan, we also have some of those similar numbers. I thought it was interesting to highlight that 22% of Michiganders reported they weren't able to get the care they needed, and really these were the reasons why. Limitations in their insurance coverage, a shortfall of psychiatrists or mental health providers, lack of getting to the treatment types they wanted, and a disconnect between primary care and some of those services. Next slide. I feel like this is where primary care can really help cover that gap. So personally, I feel like I do a lot of mental health care within my primary care family medicine clinic, and some of the numbers bear that out. So although it's a little bit older, some of these statistics from 2010 showed that 20% of visits in primary care actually were for a mental health concern. And this graph, I think, is really illustrative. If you look across the bottom from the left to the right, the left is in larger metropolitan areas to smaller, medium, all the way over to rural. And you'll see an increasing amount of mental health care provided by primary care physicians versus psychiatry. So as you get more rural, the larger the amount of mental health coverage being done in primary care. Next slide. So really, I think primary care is where we might be able to really support the early screening and getting of care early. So in family medicine, we often talk about how to treat chronic disease starting from prevention. And I think that same philosophy is really pertinent to mental health. So identifying early warning signs, both in ourselves and in those around us. Often those minor, sort of easier to hide signs of low mood, anxious thoughts, finding things less pleasurable or enjoyable are things that we can manage to keep going through until they start to progress and interfere with our work and school. There are a lot of online tools to start screening process, but I would argue that getting to your primary care doctor is one of the major things you can do. Next slide. So in primary care, there's often a pre-existing relationship with a provider, which can help overcome some of that anxiety about asking for support or care. And if you don't already have a primary care doctor, this might be a great time to find one. So in case people aren't familiar in primary care, we're trained to provide first-line options for treatment of most anxiety and depressive disorders with medications, referrals to counseling, brief interventions, and frequently have some of those embedded professionals within our office. The other thing we can do is counsel on lifestyle supports. And with that, I'm going to offer you a little quiz. So the next slide, please. So our first poll should come up. What lifestyle measures do you think best support mental health? And we'll wait a second while people get a chance to vote. And then I will share which ones we can all be doing at home to help keep ourselves well and resilient. So we should have an answer here in just a few more seconds. I'm hoping everyone on this webinar has gotten a chance to do one of these things in the last 24 hours. And exercise is by far the winner. Interesting. So in case people hadn't already picked, this was actually a little bit of a trick question where all of these things on this list are actually things that help support mental health. And I'm going to tell you a little bit about why. So next slide. If we can advance the slide. Great. So evidence for supporting lifestyle or supporting mental health through lifestyle. So everyone got the exercise one right. Obviously that has a lot of benefits and we've known about that for a while. Healthy diet, not very many people picked that one, but there's actually some really strong evidence showing a lot of correlation between poor dietary quality and poor mental health. There may be confounding factors there, but some increasing evidence is starting to show that as we improve dietary quality, we also support improved mental health. Some people did note sleep. Sleep is actually very highly correlated with mental health, so supporting sleep can be a really important piece. Social disconnectedness, so our relationship quality, is also a big factor and can be an independent risk factor for anxiety and depression. Next slide. Meditation, lots of support around the use of mindfulness-based strategies, which is something we're all hearing a lot more about. But there's a lot of support for finding those resources out in our community with classes and also different apps and things to begin to start to incorporate some of those skills. Engaging in hobbies art, both active and passive, which I thought was interesting, either doing these kinds of hobbies and engaging in those on your own, or even just viewing them and passively taking them in can be really stress reducing and mental health supporting. Nature and spending outside time in nature is also gaining increasing evidence. And with that, we'll go to our next slide, which is actually a second poll, which is me asking all of you to commit to the thing you're willing to do to help support your own mental health. So it sounded like many people thought exercise was important, but you can also pick other ones here too. So I would encourage you, if you picked exercise, to expand and think about what other things you might be interested and or willing to engage in to try and support your mental health even further. And in case people didn't see the quick slide of me and my daughter in a kayak, I chose one that actually covers all the bases. So I get my social time with my daughter, my outside time in nature, and a physical activity all rolled into one. So I highly encourage you to multiply your activities by combining them together. And here's the answer. Awesome. So many great responses across the board. So I hope you all got at least a few tips of things you can do. And I think with that, my time is up.
Thank you so much, Dr. Schneiderhan. Wonderful to partner with family medicine on the front lines of mental health care in terms of integrating mental health into primary care. Enjoy working with you on that, and your perspective is appreciated. Let me now introduce and welcome Dr. Polly Gipson for her presentation. Welcome, Dr. Gipson.
Okay, thank you. During this unprecedented time, pandemic-related stress for parents and caregivers is at an all-time high. Nearly 3/4 of parents are worried about the impact of their child's social development. More than half have described their child as exhibiting behavioral warning signs as a stress response. We know that parents are the emotional barometer for their kids and families. So first, parents must be aware of their own emotions to recognize and help their children respond to their reactions. That is, thoughts and feelings in an adaptive way. Next slide, please. A recent poll also revealed additional sources of stress for parents, which includes significant concern about themselves and or loved ones contracting the virus, the ways in which the virus has significantly altered their daily living, as well as the losses experienced, and one form is major milestones. We know that children are keenly aware of their caregivers' reactions, so now more than ever is the time for parents to put worry into positive action. One way is to model self-care practices. Next slide, please. As I mentioned, families are experiencing a range of grief and losses. Losses can range from tangible losses such as deaths, loss of events and celebrations like graduations and weddings, as well as loss of employment. Losses may also include intangible experiences, like feelings of loss of control and loss of endings that contribute to kids' significant distress. For instance, we know that African Americans are 13% of the US population, yet tragically are experiencing 30% of COVID-related deaths. So it's important to be mindful of your particular groups and the ways in which your children and families are experiencing losses. Some ways to help your children cope with their grief reactions, particularly if it relates to the death of a loved one during this trying time, is to share positive memories about your loved one, to honor your loved one with your family and faith traditions, and to co-facilitate with your children reflections on gratitude and meaning making of them in your lives. Next slide, please. Further, while the COVID-19 pandemic is a collective trauma, it has resulted in disproportionate impacts, as I mentioned, with certain populations experiencing grief. We also know that for the Black and Brown communities, racial discrimination is also a significant source of stress. And we know from recent survey data that this is impacting all populations in our nation. So it's important to have those crucial conversations at the dinner table with your children as it relates to race and social justice. Next slide, please. Research also informs us that children's chronic exposure to adversity in the absence of family and community support results in toxic stress. Thus, rightly so, there has been great attention given to childhood adverse experiences, or ACEs. COVID has broadened our understanding of ACEs to include adverse community experiences as well as adverse community environments. Children exposed to traumatic experiences like intimate partner violence, food and housing insecurity, as well as the underlying roots, if you will, these traumatic environmental factors such as poverty, discrimination, and stagnation and upward mobility, places these kids at elevated risk for a host of mental and physical health related conditions, right now in their development as well as into adulthood. Some of these conditions include depression, suicide, obesity, and cardiovascular disease. So it's important as a community to think about ways that we can foster resilience for all of our children. Next slide, please. So COVID-19 has brought a host of casualties. The one that I will turn to now is focusing on suicide rates. Next slide, please. We know that before the COVID-19 pandemic, that suicide was also a pandemic in our country. Tragically, suicide was the second leading cause of death among adolescents in the United States. As you can see from this graphic, we know that males are significantly more likely to die by suicide than females, although females do engage in more suicidal attempts. We know that from 2009 to 2018 that the youth suicide rate increased 61.7%. Next slide, please. At current, there is little data to inform us on the suicide rate for teens during COVID-19, but we know from our most recent national survey that was conducted in 2019, as you can see here, we can see a significant difference in terms of males and females and their expression of suicide risk. But I think we can all agree that far too many of our children are suffering. Nearly a quarter of adolescent females reported seriously considering suicide, with close to 20% reporting that they made a suicide plan. And as you can see here, 11% reported actually engaging in a suicide attempt, as well as 7% of boys. During these trying times, it's imperative that we understand the warning signs of suicide. For example, expressing suicidal statements, noticeable and concerning changes in your child's mood and behaviors, and that we work to connect these teens at elevated risk to mental health services. Next slide, please. So how can you help? We know that positive coping is the antidote to stress by being a supportive source for teens and co-facilitating their adaptive coping strategies. We encourage you to help them to focus on their routines, to help them stay connected, to be a person that they can talk to help them to be more comfortable, and to also help them practice self-kindness and self-compassion. Next slide, please. So lastly, I will leave you with some resources that will be posted on our website. Thank you.
Thank you so much, Dr. Gipson. Such an important body of work. And I know we'll be touching on it more as we get into the question and answer. Let me move right now to Dr. Mark Ilgen to talk about substance use and addiction. Thank you, Dr. Ilgen.
Great. Thank you so much for the introduction and the opportunity to present here today. I'm going to be discussing the relationship between the COVID-19 pandemic and problematic substance use. What do we mean when we say problematic substance use or addiction? We're usually talking about two distinct but related domains. One of those just reflects the use of the substance, the quantity or frequency of what's being used. And the other domain is substance-related consequences. And these are things like engaging in risky behaviors or experiencing negative consequences because of the substance on social relationships, on work, or on health. Usually, for most people, there's a pretty consistent relationship between these two domains. The more substances someone uses, the more likely they are to experience consequences. And it's often those consequences that bring people into treatment. However, with the COVID pandemic, we're finding that these relationships are changing, and some of the patterns may look different as we move forward through COVID and then hopefully as we get into the period after COVID. Next slide, please. So what are we seeing related to substance use and COVID-19? We know from historical studies that exposure to large societal stressors is associated with increases in self-reported stress, as well as the use of substances to cope with stress. And early data from 2020 seemed to parallel this pattern or fit this pattern. For example, we see remarkable increases in the amount of alcohol sales or the volume of alcohol being sold in this country, and less dramatic but similar increases in cannabis use. The relationship with substance-related consequences seems to be a bit more complicated. So you do see some indicators of problems like overdoses, for example, that have increased in this year relative to last year. However, there are other consequences, things like driving while impaired, that have decreased dramatically as people are not driving around as much as they were and are home-based more of the time. And so these relationships may look different in the current environment. Next slide, please. So if some of the standard markers of problems are less apparent, what should people be on the lookout for related to their use of substances? And one of those things that I want to highlight is the reason for use. We know from close to 3 decades of research on the development of problematic alcohol use that most use of substances begins in late adolescence and young adults, and is motivated by the belief that use of the substance can make an activity more fun or enjoyable. It's often used for celebratory reasons. However, there's a sizable subset of the population who also reports using the substance to cope with negative emotions or experiences. And that form of what's called in the literature drinking to cope is a potent predictor of developing a problematic pattern of substance use or an alcohol or drug use disorder. Why do I bring that up here? Because as you see online, there are many jokes about people coping with the stress of COVID by using substances, usually, drinking to deal with the stress of COVID. And that's one thing if COVID is a short-term stressor, but as COVID drags on and stretches into months and multiple months together, the concern is that these patterns of using alcohol to cope with that stress could become more entrenched and the problems could get worse before they get better. Next slide, please. So what can you do if you want to change your substance use, either for yourself or a loved one? One is just to reduce on your own. People can set targets for how much they want to consume and then try to stay within those targets. However, a sizable minority of people find that no matter what target they set, they have difficulty staying within that. And that could be an indicator that more intensive services are needed. This could involve self-help services, either 12-step like AA or NA, or non-12-step services like rational recovery are available in the community and can be helpful. And so can formal substance use disorder treatment. Next slide, please. When we're talking about substance use disorder treatment, it's available in a wide variety of settings, from residential or inpatient settings to outpatient types of therapy and medications. And nowadays, outpatient therapy is by far the most common way in which people receive treatment for substance use disorders. During COVID, many of those services are available online. That includes U of M's addiction treatment services, as well as many other treatment resources in Southeast Michigan and around the country. We have a link up here to our webpage, and that can provide more information about treatment services that are open and providing services during COVID. There are also, there's been an expansion in the use of online self-help groups, as well as apps to support changes in substance use and recovery. It's not necessary for people to know what type of treatment they need when they reach out for help. Most treatment programs involve an intake assessment where they help the individual find the option that will fit their needs. Next slide, please. So just to sum up, it looks like levels of use of substances have increased, as has stress. In these times, it's worth being vigilant about your own use or the use of those people you love. And if you want to make changes to your use, the good news is there are many pathways to making those changes. Treatment resources are available. They tend to be quite effective. And one silver lining of COVID-19 is that many of those can be accessed remotely, which will hopefully expand use and hopefully benefit from these services. Thank you.
Thank you so much, Dr. Ilgen. It's great to end on an optimistic note about being positive about making changes that help us reduce potentially harmful behaviors. It's my pleasure now to welcome Dr. Liz Duval for our fourth and final presentation. Dr. Duval.
Hi, everyone. Thanks so much for having me. It's an honor to be here today. Before I get started, I would like to do a quick poll of the audience. So the question is, how many of you are feeling anxious or stressed right now? And I'll give everyone a minute to have a chance to respond. All right, and it looks like the majority of folks are feeling anxious or stressed, which is not surprising. What I'd like to do today is talk with you a little bit about anxiety and stress in the context of the COVID-19 pandemic, and to also offer some additional strategies that may help cope with those feelings. So next slide, please. So anxiety is a normal and adaptive response to threat. When we encounter something scary or stressful, there's a part of our brain called the amygdala that acts as an alarm to help keep us safe. And this alarm responds to all kinds of threat. So, for example, if we encounter snakes or spiders, that alarm may go off. And with the ongoing concerns about the global pandemic, the alarm is being activated for many of us on a regular basis. And while anxiety can be normal and adaptive in response to threat, for some people and under certain circumstances, it may become excessive and begin to cause distress and impairment, in which case assistance from a professional mental health provider may be helpful. Next slide, please. And in the context of the pandemic, there are several risk factors that can increase pre-existing symptoms or can contribute to the development of new symptoms of anxiety and post-traumatic stress. Some common risk factors include things that have already been touched upon by my colleagues on the panel. As far as what we're seeing in the clinic, some common themes are an increased concern about health and safety, both for ourselves and our loved ones, financial and economic concerns, difficulties managing changes to our routines, schedules, and responsibilities, significant losses, and having to make decisions in the midst of a lot of uncertainty. We're also seeing some people in our clinic who have survived coronavirus infection, which is sometimes associated with intensely stressful and life-threatening experiences, which can lead to post-traumatic stress reactions, as well as other types of mental health symptoms. In addition, the period of recovery and adjustment after a serious illness can pose its own challenges. Next slide, please. So my colleagues on the panel have described some excellent ways to manage anxiety and stress. I want to describe a few more brief strategies that can be incorporated into our daily routines. And the good news here is that there are many effective coping techniques out there, whether you have an anxiety disorder or not. At the same time, it can be hard to make time to practice them, and all the different options can sometimes feel overwhelming. So I would suggest that those of you looking for coping skills, try out a few different strategies to see what is most effective and feasible for you. And it may also be helpful to coordinate with friends or family to check in and provide support as you work to incorporate new habits. So to give you a few examples of some techniques that may be helpful, affective labeling is one strategy that involves articulating or labeling how you're feeling. And it can be as simple as saying something like, "I'm feeling anxious." Research has actually found that the act of labeling our emotions helps us regulate them more effectively. Mindfulness exercises can help us focus on the here and now and to be more present in the moment. One example of a mindfulness exercise that is pretty quick and can be done anywhere is the 5-4-3-2-1 exercise. And this involves identifying 5 things you can see, 4 things you can touch, 3 things you can hear, 2 things you can smell, and 1 thing you can taste. Box breathing is one example of how we can regulate our breathing, and breathing exercises have also been shown to help kind of reduce our baseline level of anxiety or stress. And the way box breathing works is you practice inhaling, holding your breath, exhaling, and holding your breath for specific amounts of time. In this example, it would be 4 seconds each, and you would go through several cycles of this breathing routine for a few minutes at a time. These kinds of exercises can help reduce stress levels over time with consistent practice. And what I like about them is that they can be done really anytime, anywhere throughout your day. Next slide, please. It's also important to recognize that we tend to anticipate and prepare for the worst, especially in times of stress. And this train of thought can certainly help protect us from negative events and help us be more prepared. But it can also sometimes contribute to negative emotional states like anxiety. And so if you're noticing that you're having a lot of negative thoughts or worries, it might be helpful to examine those thoughts and ask yourself whether there are more accurate or helpful ways to look at a situation. Next slide, please. And lastly, our behaviors play a really important role in how we feel. Many of us have experienced significant changes in our usual behaviors and routines, and we're struggling to balance risk versus protection trade-offs. And so we may need to invest a little more time and effort right now in finding ways to implement structure into our day, connect socially, practice regular healthy habits, and engage in enjoyable activities. And we may also need to temporarily adjust our goals and expectations, both for ourselves and others, as we work to navigate these challenges. So it's important to remember that we're dealing with a lot of uncertainty, change, and transition, and it's normal to feel stressed and anxious. The good news, though, is that if stress or anxiety is getting in the way or causing impairments, there are many things we know can help, and we're here to provide support. So next slide. If you'd like more information, the Department of Psychiatry has links to additional resources that are specifically focused on coping during these difficult times, and these links will be provided in a follow-up email and on our website. Thank you so much.
Thank you so much, Dr. Duval. Thanks to all of our presenters for the rich information that you've presented. I want to invite all of our presenters back now for us to address some of the questions that we received from many of you who are participating remotely. Okay. So let me read out the questions and then maybe direct them at one of you, and we can pitch them around as well. So Dr. Schneiderhan, can you comment on how maintaining a routine while working from home can help with mental stability and wellness? Absolutely.
I am finding that patients are coming to me quite a bit, actually, talking about how their routines are very disrupted right now. Specifically, I'm seeing what I'm calling sort of work creeping, so creeping into the rest of your day. I loved what Dr. Duval was saying about maintaining structure, and I think that maintaining some sort of boundary around the time you're working, especially from home, can help protect some of those other self-care behaviors. So making sure bedtimes are staying the same and we're getting the self-care pieces in, I think can help with the overall mental wellness.
Great, thank you. Dr. Ilgen, what are some informal treatments or tips for managing alcohol use, given that drinking has increased as you described during the pandemic?
Yeah, there are a number of strategies people can use to monitor and manage their own alcohol use. A lot of those are now available online. It seems like every week there's a new app released to help with this. And there are really 3 main components to these. One helps people track their use. So there are different ways of monitoring how much you're using, and to develop targets for your use that are specific to your age and gender. The next domain is teaching coping strategies. So some of the things that Dr. Duval mentioned for anxiety can be very useful in terms of dealing with stress without using substances. And so they'll teach those other strategies. And then the third domain is developing a social context that supports either sobriety or reduced use. And most of the effective approaches combine all three of those elements.
Great, thank you. So important to kind of reflect and monitor and stay mindful of what we're doing during these times. With the start of school, so much concern about the development of younger children. Dr. Gipson, how can we continue to promote healthy social development for young children in the midst of this pandemic?
Thank you for that great question. I have the pleasure of directing a school-based program that's focused on increasing trauma awareness. And we took CALM and came up with an acronym to help children and families during this difficult time that is also applicable to young children. So for this acronym, the C stands for communicate. And what we mean by that is it's important for parents to go to their young children and to talk with them. They have heard about the virus, they have worries about the virus, so it's important to get an understanding of what they know and to share simple, honest information, also to validate their feelings. The A stands for active. During this time, it's so important, and this theme has come across in many of what my colleagues have stated, is to help your child to stay active, help them to have routines, help them to continue to be creative and keep a schedule. The L stands for learn. It's important for you to either be more aware or learn your child's signs of distress, particularly during this time. How are they showing you that they're stressed about what's going on in terms of maybe being at home for school, not having opportunities to engage with family members and friends. And then the M stands for model. As we mentioned, it's also Self-Care Awareness Month. And it's important for their caregivers to model positive coping strategies and then help to engage their child in them as well. Thank you.
Great, thank you. I'll also invite other speakers, panelists to jump in at any point if you want to add additional comments. Dr. Duval, I may ask you to do a little bit of a deeper dive into the best way to deal with anxiety disorders during this time, including panic, generalized anxiety, OCD, agoraphobia. Maybe you can chat about that a bit.
Yeah, absolutely. So for those of you who may be dealing with an anxiety disorder, or if you know someone who is, my first advice would be to get support. You don't have to deal with it alone. And we know that stressful circumstances like the pandemic that we're dealing with now and some of the other stressors going on can exacerbate our existing mental health concerns. And so if you're dealing with an anxiety disorder or other mental health condition, stay in contact with your existing providers or reach out to establish new relationships with providers. There may be a wait for treatment with a specialist, and so starting with your primary care provider, as Dr. Schneiderhan suggests, could be really helpful. And also to continue to use healthy coping skills, utilizing some of the online resources that are available in the form of apps or other online content, and other sources of support that may be available to you. One thing that I think is important to note is that people with anxiety disorders tend to overestimate risk and thus avoid activities that they want or need to be doing out of fear. And a focus of treatment is to help adjust perception of risk and to work toward doing things that feel frightening but are generally safe. And so it's important to remember that even though the pandemic does pose real threats, and that a lot of these threats and changes and challenges can exacerbate specific anxiety disorder diagnoses like OCD for some people or agoraphobia, there are still a lot of ways that we can find strategies that are safe that can help reduce excessive anxiety and improve functioning even in the face of realistic threats in our environment.
Great, Thank you so much. Dr. Schneiderhan, I wonder, we had a question about tips and tools, mindfulness tips and tools for students. I wonder if you could comment, in your experience, students maybe at a couple of echelons, young, maybe high school, maybe college, just to sort of maybe cover the waterfront a bit.
Yeah, absolutely. I find mindfulness can be such a useful tool because you can utilize it ever you go. I love Dr. Duval's slide with her, tips for mindfulness. The 5, 4, 3, 2, 1 was really wonderful. I think other tips I think about are small little strategies like that. Another one would be, for older echelon would be sort of simple things around breathing, like counting your breaths. And so having a count in and out with each breath up to 10 and then back down can be a really nice calming, regulating breath exercise as well. There are a host of apps out there, and I think there really are apps for almost all ages now to start to practice some of those mindfulness skills. Some of my favorites for a broad spectrum would be the Calm app. Dr. Gipson used Calm for an acronym. There's actually a wonderful app called Calm that really focuses in around the sleep hygiene as well. But they have sections within that app for every age range, and I find the meditations around mindfulness in there are really accessible. Headspace is another one that also does a very simple overview of basic mindfulness skills. And then one I like for people who want maybe a little bit more cognitive, so this might be your older age range, would be 10% Happier, where they have little courses in there on specific mindfulness strategies. So there's intros to mindfulness, but also mindfulness for anxiety, self-compassion courses, things like that. So kind of diving deeper into specific skills. So those would be my basic.
Thank you so much. Thank you. Obviously a question of concern. Dr. Gipson, maybe I'll ask you to take the first pass at this. What do I do if I'm concerned someone may be suicidal?
Yes, I'm happy to address that. First and foremost, I would take that concern seriously and I would act on it. And what I mean by that is I would go to your loved one or your friend or whoever you have a concern about, and I would talk to them. And I would not shy away from using the word suicide. You can let them know that you're concerned about them. I would tell them the reasons why, like what you've noticed in their actions or their behaviors or even their expression of emotion. And just have a vulnerable, open conversation with them. Ask them, have they been thinking about suicide? Are they considering it? And if you hear things from your loved one that is even more concerning, I would encourage you to seek help from a mental health provider. If it's something that feels more imminent, obviously you can take them to their local emergency department to get an evaluation right away. But it's important to act on your concerns, to express your concerns, and also just to let them know that you're going to be there with them along the way. It's important to validate that this is just really a stressful time and it's very difficult to cope. And sometimes young people are having these thoughts even when they don't want to. So hopefully that's helpful to think about some steps that you can engage in to intervene with someone that you're really concerned about.
The university has this program called If You See Something, Say Something, very much in line with what you're talking about.
Exactly.
Was there another comment someone wanted to make?
I just wanted to add in that I think that's also a really good space to reach out to a primary care provider if you have one already and don't have a specific mental health provider, just because having that relationship might get you care a little bit faster and the primary care provider can help you triage.
Great.
And assess that and have conversation around what's happening.
Yes, absolutely.
Great. Dr. Ilgen, what can one do if someone has both a mental health and a substance use disorder problem, that very common co-occurrence?
Yes, this is a challenging situation. As you point out, it is very common. It's the case that probably 50 to 60% of people who at least come in to receive treatment for a drug or alcohol problem have some type of co-occurring mental health problem. And for people who are not yet in treatment, it can feel kind of paralyzing. They can feel the links between not feeling well in terms of their mental health and their substance use, and not really know where to start to break out of that cycle of, let's say, for example, low mood and substance use. I think the good news is there's really no wrong place to break that cycle. So if people start by seeking help for the mental health problem and then end up changing their substance use along the way, or vice versa, come to seek addiction care first, they can change those patterns and end up experiencing improvements in both of those domains.
So the idea of taking a step and being active, not allowing the paralysis to overtake you, with the sense that it's too big to deal with. Great, thank you. You know, one of the hardest parts of the pandemic for many families is the uncertainty. When is it going to end? What will normal look like in the future? Will life ever be the same? How do we deal with this uncertainty in healthy ways? Maybe Dr. Duval, you can take the first pass at that.
Absolutely. Yeah, I think uncertainty is really hard for all of us. And one thing to keep in mind is that we do get better at tolerating uncertainty with time and practice. You know, it's normal to want to understand what's going on and to know what things are going to look like in the future. And transitions and unknowns can be really difficult. But the good news is that our brains and our bodies are really good at adapting. And over time, as new information comes to light, we may find that there's less uncertainty to manage. And so things may get a bit easier. But as far as practical suggestions, I would say to try to focus on the things that we can control now. So what can we do to create structure or routine that works for our current situation? What are some healthy and fun activities we can engage in safely? How can we incorporate some of the helpful coping strategies that we've talked about into our daily routines? And identifying the different supports that are available to us and reaching out and utilizing them. And also making sure we're staying connected to friends and family in creative ways. You know, I think one really important reminder is that social distancing doesn't have to be social isolation, and that we can find ways to reach out and get support from one another and from professionals when needed. So hopefully that's helpful, at least in thinking about some things that might help manage some of the uncertainty.
Yeah, I've actually thought that the preferable term for me is physical distancing, but not social distancing, right? You're trying to not be proximate, but to interact in other ways and be creative about that. We have a lot of folks transitioning in life stages, kids moving from elementary to middle to high school to college, those who are getting older, maybe being more isolated by issues around their health or loss of partners, spouses. I wonder if we can share some tips for supporting mental health at some of those various stages for folks who are feeling socially isolated, ways that they can reach out and connect. Polly, Dr. Gipson, you want to start with maybe the younger group?
Sure. I would say one of the things that schools is doing that is very important is they're focusing on kids' social and emotional learning as well as their academic learning. And I think that's important for parents to continue to do that within the home context. You know, we've talked about a lot of great strategies in terms of, I frame it as just trying to look at opportunities. So yes, this is a trying time, but this also poses a time for families to have some opportunities. Families are spending more time than ever before with each other. Your child may have had an interest or a hobby that, you know, they weren't able to engage in because frankly, before the pandemic, most of our children were overscheduled. And so I would encourage parents to really work with their kids in creative ways to involve these ideas of social emotional learning within their home context, and to not lose sight of their traditions. You might have to do them in a non-traditional way. So for instance, my family participates in church virtually, but we're still a part of our faith community. And so I would encourage you to think about things that you were doing before the pandemic that you might have to tweak, but you can still have your children engage in. So those are just some ideas.
Great, thank you. Any other folks want to make comments? I will say for those of us of a certain age, there may be some trepidation around connections via Zoom or Blue Jeans or whatever your preferred platform is, but trying to take some risk going out there, maybe even getting your children and grandchildren to walk you through it is a great way to make sure that you can do something beyond phone calls and maybe if you're a traditionalist, letter writing as well. But that opportunity to be socially interactive on a video platform can be very, very positive, particularly for those who might be isolated because of their health concerns, where they're living, if they're away from family, that sort of thing as well. Are there suggestions about how to achieve better sleep during this pandemic? Dr. Schneiderhan, maybe you want to give us some of your suggestions?
Yeah, there's some interesting research showing that because of some of the increased anxiety, we're actually a little bit more hypervigilant and our nervous systems are a little more agitated, meaning our sleep is more disrupted during this time than ever before. I think something that we don't always think about is exercise, and actually exercise and sleep quality are very closely linked. So for all the participants who voted that exercise was a great way to support mental health, it also works to support sleep. The other thing I would say is just, as we've been, I think, preaching a little bit, but routine. I think getting to bed on time, we often use this phrase sleep hygiene, so caretaking our sleep environment. I think now more than ever, making sure we are taking a break from the screens because so much of our interaction is happening that way, but making sure we're giving our minds and nervous systems and bodies a rest from that before bedtime, getting to bed on time, controlling our environment, I think are the best ways that we can really support restful sleep right now. And just acknowledging that it is a little bit different just because of this heightened state of awareness and yeah.
So, and I know for some folks, they may turn to substances, alcohol maybe in particular, to help with sleep. So it's something else to pay attention to, Dr. Ilgen?
Yeah, definitely. Sometimes some of the strategies, especially medications and alcohol that work pretty well the first few times you use them to get to sleep, stop working well and then become part of the problem. So unfortunately, people may find that drinking could make them feel drowsy and help them get to sleep for a little bit. But again, as this pandemic drags on, those strategies may be undercutting the quality of their sleep and making their sleep worse and themselves feel worse over time.
Great. Dr. Ilgen, let me just go back to you with one other question about treatment for alcohol problems and whether what the role is for medication in treating those problems.
Sure. So medications are more and more a part of effective treatments for substance use disorders. That's true for a number of substances. I think it's particularly true for alcohol. Many people remember or have heard of certain medications like antabuse or medications been around for a long time that make people sick when they drink, and but they haven't heard of the newer medications that are out there that can really address some of the drivers of alcohol use, medications that help with craving, that help people scale back on or reduce their use, or even the use of medications to help with psychiatric symptoms. And all of those, if they're used creatively, can really help people scale back on their drinking or abstain if they're put into play at the right time.
Great, thank you. So we're heading towards the end. I'll ask the last question, maybe a big picture one. As we face the reality of this pandemic with the risks, how do we help each other maintain a hopeful outlook? Who is the most courageous and wants to take that on first?
Well, I don't know if I'm the most courageous, but I will take that on. I think it's important to focus on gratitude. Even during this time, there are so many things to be thankful for. And so because I'm focused with kids and adolescents, this is a good opportunity to model this for your children. When you wake them up in the morning and they're going through their routine, give voice to things that you're grateful for that day and ask them to give it as well. Or you can even do it during your dinner time. But find daily practices for expressions of gratitude for you to model as well as to elicit from your children. And I think that this goes a long way in helping them during this difficult time. Thank you.
Thank you. Great way to end our question and answer session. So I want to thank all of our panelists for offering their valuable time and expertise during this webinar. I want to thank all of our many attendees for your engagement and interest. We hope that you found this session informative and that you learned some things that might be applicable to your lives, even that you can use later today. We truly appreciate the opportunity to shine a spotlight on a few of our mental health experts at Michigan Medicine. We would welcome future engagement with those of you out there who would like to learn more. And I want to extend a sincere word of thanks to our wonderful donor community. A special thanks to those of you who have joined us throughout the summer to learn about Michigan Medicine's response to the COVID-19 pandemic and other important issues. We look forward to keeping you well aware of our activities in the months to come. As a reminder, a recording of this webinar will be sent in a follow-up email, and we will also send a list of helpful resources. Please join us for the next Well Aware webinar on October 8th at 1 p.m., in which our experts will discuss the discovery science behind the race for treatments and a vaccine for COVID-19. Please stay healthy and safe this fall. Thank you, and go Blue.